Hello, everyone. I'm Dr. Marty Ross, and tonight this is another Conversations with Marty Ross MD, and we're going to talk about Lyme disease. These webinars are never identical because you create them with your questions, and as usual, I'm very interested to see what you have in store for me tonight. So just a little matter of administrative issue here tonight. Not issue, but something I want to bring up. Next week, I originally was scheduled to have a webinar with you on Thursday. I this morning moved it to Wednesday. So if you had previously signed up for next week's webinar, you will need to re-sign up for it again. And we'll be doing it on Wednesday at 4 p.m. I'm just not able to keep the 4 p.m. on Thursday next week, so I moved it to a Wednesday, okay? So tomorrow morning when you, as many of you know, I do create recordings of these, and tomorrow morning you'll get a recording email notifying you that the recording has been edited, and I create a synopsis of it, so you'll be able to take a look at that. In that email, there will also be a link to sign up for the webinar for next Wednesday. So just keep that time change in mind. For those of you that are coming back here again, I see a lot of familiar names. It's good to see you. I'm glad you keep coming back and you're getting benefit from this. For those of you that are new, the way you participate, there's a couple ways. Number one, you could watch and listen in, and I'll read everybody's questions that I'm going to answer, and then I'll give an answer. And I do a lot of explanation, and sometimes I get a little long-winded. Hopefully not too long-winded, but enough to give you information to be able to work with the question. Okay, so you can learn that way. Second way is to write a question to me. And the way you do that is on the bottom side, right-hand side of your screen at the bottom is a chat box. And you can use that to write a question to me. Now, the only thing to be aware of is every time you click enter, it sends a question to me. So if you're using the enter key to create paragraphs, forget it. It just that you can't do it that way, okay? Because otherwise it's very confusing on my side to be able to follow your questions. Basically write your whole question as one big long run on, and then hit your enter key when you're ready to send the complete question to me. Also, when you send a question to me, it does not stay on your side of the screen. So it's going to look like you didn't do anything, but you did. You sent it to me, okay? So I will not be able to get through everybody's questions, and I never can. I get through a lot of them, but I never get through everybody's. And I'll take as many as I can, okay? So bear with me as I work through your questions, and hopefully we'll get to yours. Yeah, I think that's it. So we got an hour and a half to spend together tonight, and I intend on spending an hour and a half with you again next week as well, too. So without any further ado, let's go ahead and get started here. Oh, during the live webinar, I will, if you're participating in the live version, you will be able to read the question. It will show up on the bottom of your screen. That does not happen, though, in the recorded version. So for those of you that are listening to the recorded version in the days ahead, I'm going to read the questions out loud so you can hear them. Okay? All right. So let's go ahead with the first question here. This is from Jim. Jim says, thanks for doing these great webinars. You're welcome, Jim. Let's see, what are your thoughts on getting a fourth dose of COVID vaccine? Do you think it's better to get one now or wait for an updated Omicron vaccine? What has been the experience of your patients who have received a fourth dose? Are there any downsides to a fourth dose? I have seen some talk from serious medical people, not conspiracy theorists, that a fourth dose of the original vaccine might cause immune system problems in some people. Any thoughts on this? Okay, so I'm not sure about the fourth dose causing immune system problems, to be honest, because I haven't. Now, granted, anything can happen, and there are rare people that have had complications from the COVID vaccine. But on the whole, most people have gotten benefit from it, and it appears to have done the job that it was supposed to do, which is keep people from getting complicated COVID out of the hospitals. And even if they go in, they're not dying from it to the same degree they were before we had the vaccines. Okay, so the vaccine does seem to work. My feeling at this point, I know they've recommended a second booster. And even myself, I've held off on getting that second booster. So I was very much behind getting the first two in the series and then my first booster. But I have held off on the second one. And let me explain my reasoning, which you'll have to decide is right for you. It's a very personal decision, okay? So I do agree that if you get a booster right now, that will boost your immune system. It will become more active at fighting COVID, okay? The trouble is that the vaccine that we all had originally and now that we've got boosters for does not currently match well enough the type of COVID that's out there. And so you're going to get a boost and it will help. It will help. But my feelings is that I'm waiting personally to see that when they develop the newer strains, and supposedly they are doing that. And I'm holding off myself on getting the booster until we see that they have the new one that deals with some of the Omicron strains as well too. That's when I will probably do it myself. Okay. Now, be aware though. I mean, you've got to weigh out that there's a lot of COVID out there now, and we've said that all these variants are still spreading. We've got quite a bit of COVID in the country. But on the good side, because most of us have had vaccines, or we got it, or we got vaccinated and we got it, like me. Basically, I think that we're probably all going to tolerate getting COVID again if we get it. And that's the difficulty of this whole situation right now is COVID looks like it's going to become endemic here, meaning it's just going to be out there. And no one really knows for sure. We're going to just see it get weaker and weaker and people's response to it get stronger and stronger over time, or what's going to happen. I don't think we know. But my own personal preference has been to wait. And if I get asked by my patients, that's what I'm advising them to do as well, too. But again, you got to make your own decision on that. In terms of what I'm seeing with people that have gotten the 4th dose, I don't have enough experience to know, to be honest with you. Okay. All right. Thanks, Jim. Good luck to you. Hello, Duke. Let's see how Dr. Ross. Can you go over the Igenex IFA test for Lyme? I had a titer level of 80, which Igenex marked as positive. If you get a positive on that test, does that mean you definitely have Lyme? What are the chances for false positives or false negative on the test? These webinars are greatly appreciated and extremely helpful. Thank you. All right. So and thanks for those comments too. So Duke, basically, so testing is broken down into what we call screening test and what we call confirmatory test. Okay. Screening means we do a test to see if you might have the infection. And if that comes back positive, then we're supposed to do a second test to make sure that that first test was correct. Okay. All right. And the problem with screening tests is there is the possibility of getting false positives. All right. So for instance, one of the screening tests that the Infectious Disease Society of America recommends is to do something called an ELISA test. Okay. This IFA test is very similar to an ELISA test. And both of those tests have the ability that when they come back positive to be wrong. Because what they're really asking is, do you have any antibodies in you that might have fought Lyme before? Okay, might have been made to attack Lyme. And if it comes back positive, we recognize that we're throwing a big net and we're basically catching too many fish. So to get those antibodies for Lyme, we're also catching a lot of mackerel, and it'd be like a fishing net. So if you're going for try to find salmon and you throw a net up in Alaska, you're going to get salmon. You're also going to catch a lot of other cold water fish too. Okay. But then what you want to do is come back and pull the salmon out. And so the way we do that is to get a confirmatory test. And what that confirmatory test is either an immunoblot or a Western blot. Okay. Now, most of us, because these ELISAs and IFAs have a high chance of being wrong, just skip doing them. And in fact, I don't do an IFA anymore. I don't do ELISAs either. It's possible they may be, when you get a positive test back, it could be wrong up to 50% of the time. Okay, that's pretty high. So what I do, I just go right to the immunoblot. Now they offer a Western blot and an immunoblot. Those are two ways to see, to look and see, do you really make antibodies attached to the Lyme germ? Of those, the immunoblot is the better test. And the reason it's a better test is for two reasons. The immunoblot looks to see if you're making antibodies against 8 kinds of Lyme germs versus the Western blot that Igenex does only looks to see if you have antibodies against 2 strains of Lyme. Okay. And those 2 strains are the original East Coast strain and a West Coast strain. All right. The immunoblot, looking for 8 strains, is actually a couple of those that they look for are European strains, something called Borrelia afzelii and something called Borrelia guerinii. And those European strains are becoming pretty prevalent out on the East Coast of the United States now and up into the Maritimes of Canada too. So it's a better net. It gives you a better fingerprint, okay? The other thing that makes the immunoblot better that Igenex does is they, by comparison, the way the Western blot is done is we grow Lyme germs in the lab and we kill them. And then we take their proteins and we spread them out in a test strip based on what they weigh. And then we see, do you have antibodies that attach to the proteins that weigh a certain amount, okay? But the way that the immunoblot is done is we take genetically modified proteins that we grow in the lab from these 8 different strains. And what's done in terms of the genetic modifications is we program bacteria to grow these proteins in a way that the proteins that are grown do not give false positive results. And specifically, one of the problems we have with a Western blot is sometimes when antibodies attach to these Lyme proteins, they were really antibodies that were made against viruses that have amino acid components that are very similar to ones found in Lyme. So we get false positive results for that. So what they do with these immunoblot proteins is they clean out the parts that might falsely hold on to antibodies against viruses, so that when we get a test showing antibodies stuck on these Lyme proteins, we know they really are against Lyme because we eliminate any possibility it could be from one of these viruses, okay? All right, so that's what makes it better, okay? So I don't do IFA testing. I don't do ELISA testing. There's a high chance of false positives there. There also is a high chance of false negatives there. I just jump right to the immunoblot, and I don't do Western blots anymore. I know the immunoblot is more expensive, but it is much more accurate and throws a bigger net, basically. Okay? All right. Good luck to you. Hello, Deborah. Let's see how Dr. Ross. In the last 6 months, I'm waking up at night with a burning, tight pulling sensation in the bottom of my feet, burning on top of my feet, moving up. My heart rate increases, and I break out in a sweat. What do you think these symptoms are symptoms of? Bartonella and Lyme. I've got small fiber neuropathy. I have severe die-off with 1 drop of herbs. What to do? Taking Picana detox. Thanks. So, Deborah, it's hard for me to say. So definitely the burning sensations that you're having are a sign of neuropathy. That's one of the things that can happen when nerves get injured. Signs of nerves being injured are numbness, loss of feeling, tingling, and different kinds of pain, including burning pain, but also sharp, stabbing, burning, electrical, piercing type pains. Those are signs of your nerves, your small nerves being injured, okay? Small fiber neuropathy means that these are the extremely small nerves as opposed to big branching nerves, for instance, okay? And yeah, I could give you those kind of symptoms. In terms of why you break out in sweats and your heart start racing, there could be a whole range of things. One could be that just having the sensation of neuropathy scares you, and you get racing heart and you get sweating from that, possible. Or it could be part of an underlying illness like a Bartonella, for instance. To figure out if you have BART, though, I need to know a lot more information. I need to ask you a bunch of symptom questions to see if there's anything else that would suggest Bartonella to me. So I can't tell by just looking at this alone, okay? So in terms of questions I would look at, I would want to know what you're thinking like. Both Lyme and Bartonella can give severe thinking, but the one that gives the worst thinking problems usually is Bartonella. Bartonella is also known for giving people a lot of anxiety or depression. It sometimes can give more predominantly day sweats, not night sweats. It sometimes can give people a sense they can't get enough air. We call that air hunger. They might get achy pain on the balls of the feet. Usually that's worse in the morning and you walk it off as the day goes on. You might get stretch mark type rashes. You might get some jitteriness or shakiness. You might have tremors. You might have seizures. Also, Bartonella can give this feeling of an internal vibration or buzzing. Okay, so I'd want to ask you to see how many of those things do you have. All right, and also I'd want to know if you'd had any testing done. Now, it's possible to have negative testing and still have Bartonella, and generally we'll make diagnoses based on your symptoms predominantly. But if you've got a positive test, then yeah, you got Bartonella. So anyhow, those are the things I would want to consider with you. So I can't say for sure what's causing this. Okay, it could either be Lyme, or it could be Bartonella. It could be part of your small fiber neuropathy, which is being caused by Lyme or Bartonella. In terms of the type of sensitivity that you're having, if you react very strongly to herbs, the main thing I try to do with people is to not improve the detox like you're doing with Bacana, but rather what I try to do is to make it so that your immune system can't make as many inflammatory cytokines. So when you get Lyme infection, the main reason you develop all kinds of symptoms, and Bartonella too, is that your white blood cells will see these germs and manufacture a bunch of chemicals called cytokines. Okay, now cytokines are good and bad. On the good side, cytokines are designed to turn the immune system on to fight the intruder. Okay, they cause more white blood cells to be made. They draw those white blood cells to where the infection is, and they help them work better. All right, that's what we want. That's why we make cytokines. However, in certain situations, the immune system doesn't do a good job, and it gets turned on. It keeps trying to make more and more cytokines to get the job done, and eventually gets cytokine excess. And too many cytokines make it so you can't think, disturb your sleep, interfere with your hormonal systems, give you fatigue, give you body pain, etc. The symptoms that we call Lyme symptoms are actually too many cytokine symptoms. Okay. Now, if you start killing germs, the immune system is going to see all of these dead germ parts and the toxins that get released, and it's going to manufacture more cytokines. Okay. So a Herxheimer reaction is actually a cytokine surge. All right. So what I have people do is to try to limit the cytokine surge. And there's two main things I like to do. Number one, I like to have people take curcumin. Curcumin is a component of the Indian seasoning turmeric, and it gets inside white blood cells and it blocks or limits, doesn't completely block, but it limits their ability to make cytokines. Kind of think of it as interrupting the factory production line, okay? And the white blood cells are the factory, okay? The other thing I like to do is combine that when people are really having difficulty with oral glutathione. So glutathione is a very strong antioxidant made in every one of our cells. It's made in large amounts in the liver to help remove toxins. And so it's got two roles in helping to blunt Herxheimer reactions. Number one, as a strong antioxidant, it decreases the signal that goes to the white blood cell factories telling them to make cytokines. Okay, those signals are oxidizing agents. So oxidizing agents hit to those white blood cells, and the white blood cells say, aha, we better make cytokines. And so what the glutathione does is it's a quick way of lowering the oxidizing agents. Okay. Second thing that the glutathione does is it helps your liver remove toxins that also can trigger the white blood cells to make cytokines. And I find it better than doing a picanha detox, for instance. Okay. So what I do, what I usually have my patients do is a curcumin product I like is a liposomal curcumin product. It means it's microscopically wrapped in fat to increase the absorption of curcumin. And that is a product made by Thorne Research. It's called Mariva 500 SF. That stands for sunflower, and that's because the oil that's used to microsecrete these liposomes is from sunflower. And it's a 500 milligram pill. I have people take one pill 3 times a day. If they're really reactive, I'll have them increase to 2 pills 3 times a day. The other thing I'll do for my glutathione, I like a liposomal glutathione. Again, that also increases the absorption of the glutathione. The product I'd like best, if people can tolerate it, and some people don't like the taste of it, but if they can tolerate it, what I like best is a product made by Research Nutritionals called Trifortify. And that's to use a teaspoonful, which is about, I think, 450 to 500 milligrams of the glutathione. And I have them do that once or twice a day. Now, Research Nutritionals has got some good studies showing that they got really good absorption of the glutathione. They've done studies of red blood cells to see what happens when people take their product and they've been able to measure marked increases in glutathione levels inside of those red blood cells. And that's why I go for that product, okay? So what I would do to try to make it so you can tolerate treatment better is try to lock down the cytokine reaction, and that's curcumin and the glutathione, okay? All right. Good luck to you, Deborah. Hello, Duke. Let's see. Can you go over the Igenex fish test for Bartonella? If you get a positive on that test, does that mean you definitely have Bartonella and you have a lot of it? Would there be any chance of false positive on that test? Thanks for all the amazing info that you provide. Thanks for saying that last part. So any test that we do could have false positive chances. That's even measuring doing your kidney liver testing, something called a comprehensive metabolic profile. Sometimes I'll get people back that their creatinine, which is a protein we measure to see how the kidneys are working, all of a sudden they'll have a randomly high creatinine, and which could mean they're getting into kidney problems from being on the antibiotics or herbal antibiotics, right? But if it's a person that I have got a history of working with that has never had elevated creatinine, I know any lab could come back wrong, any lab, all right? So there's always a chance. And so I usually go back and test it again and comes back normal. All right. So any test we do has a small chance, a very small chance of having false positives. Having said that, what the Babesia or what the Bartonella fish does is a fish stands for a method called fluorescent in situ hybridization. All right, that's a mouthful. All that means is we take a fluorescing agent that attaches to the genetic material of the germ so that we can see it under a microscope better. Okay, it's a way of visualizing the germ. So if your fish comes back positive, it means that we're actually seeing the germ under the microscope. This isn't even measuring an immune reaction that can be wrong. This is saying, yeah, we see the germ. So if we see it, it is probably there with 99.999% certainty. Again, anything is a chance of false positives, okay? So yeah, it means it's in you. And especially, okay, then whenever we do a test, again, there's always that chance of a false positive, but the predictive value of a positive test, meaning the chances that a test comes back positive, that it really is right, increases with the number of symptoms you have of that illness, all right? So if you get a Bartonella fish test back and it's positive, but you have absolutely no symptoms of the illness, it means it may be a false positive test, all right? But if you've got a lot of symptoms of it and it comes back positive, that positive test is highly predictive that you really do have the problem, okay? All right, Duke. Good luck to you. Oh, one note, everyone. So the Bartonella fish test is a good test. The trouble is you do need to have quite a bit of it in you for the test to come back positive. So even though when it does come back positive, it probably means you got it. It can miss it if you do have it in you, though. Okay. All right. Hello, Dave. Let's see. Hello, Dr. Ross. My Quest labs came back super elevated. My C4a came back at 13,595. Woo! My eyes are kind of bothering me here today. Let's see. There, now I can see you. Let's see. My C4a came back at 13,595, and my TGFbeta 1 is actually what that is, came back at 4,880. These levels are super concerning, and I don't know what they truly mean. My doctor is on vacation for the next week. I'm currently treating for mold toxicity using Welchol. Not sure if detoxing is causing these elevated numbers or perhaps something else. Any interpretation thoughts can be truly appreciated. Okay, so C4a stands for something called complement 4a. Complements are one of the tools that the immune system uses to fight an infection or to try to help break down mold toxins, okay? It can be elevated for two reasons. One is mold toxicity. Two is Lyme infection. All right. So just getting an elevated C4a back doesn't mean you have mold toxicity, because it also could be there if you have Lyme in you as well too. All right. And vice versa. Getting a C4a back doesn't necessarily confirm you have Lyme. It could be because you have mold toxicity. All right. All right. TGF-beta 1 is a cytokine, but it's a good cytokine, and it goes up to help decrease the inflammatory effect of other cytokines. Okay, kind of think of it as an anti-cytokine. All right, so it will become elevated if a bunch of other inflammatory cytokines are elevated. All right, and so it can become elevated if you have Lyme in you, or it can become elevated if you have mold toxicity in you. So all that these two tests tell me is you got something inflaming you. All right, and the two things that can give patterns like this are Lyme and also are mold toxicity. Now, there's a group of people that trained and followed the teachings of a physician named Richie Shoemaker. Dr. Shoemaker is one of the first doctors that is the first doctor that described chronic mold toxicity. And his way of diagnosing the problem is to do a genetic profile called an HLA-DR test. And if you have a genetic profile that says you might have a hard time removing mold toxins, that's what it says. I mean, if it's positive, it says you have a genetic setup that says you might not be able to break down mold toxins. Okay. And then he does a bunch of inflammatory marker tests like the C4a, like the TGF-beta 1. And he says, if you've got the genetic profile and you have some elevations of these other inflammatory immune markers, therefore you must have mold toxicity. But did you notice what I just said? His testing technique and the way that people do this, they don't go out and measure whether you actually have mold toxins in you. So there's a problem with Dr. Shoemaker's way of doing this, and there's a problem with how a lot of doctors pursue mold toxicity. And that even though you may have these elevated markers, we need to make sure you really have the problem, especially if you have Lyme, because Lyme can trigger these same elevations as well too, okay? So the way that I like to pursue this, and most of us that treat Lyme disease like to do this, is to try to measure and see, do you really have those toxins in you, okay? And the way we do that is with a urine test, a urine mycotoxin test. There's a variety of labs out there doing it. I think the best one in terms of reliability is a lab in Texas called Real Time Labs, okay? Shoemaker doesn't agree that we should be testing people. He doesn't think they're reliable, and I disagree. I think they're very reliable. I think they really do reflect what's going on with my patients. And when I'm treating somebody for mold toxicity, those are the numbers I follow. I don't follow a TGF-beta 1, and I don't follow a C4a either, okay? So are these elevated? Yes. You've got something going on inflaming you. It could be mold toxins. It could be Lyme. I don't know if you've been tested for Lyme or not. And I don't know if your doctor really verified that you have mold. Again, I usually encourage my patients to get that mold toxin test to make sure there really is a problem. Okay. All right. Good luck to you, Dave. Hello, Linda. Can you talk about the role of phages in the treatment of tick-borne infections? All right. So phages, let me tell you what a phage is, and then we'll talk about what one doctor in our chiropractor, Dr. Jernigan in Tennessee, is doing. Okay. So phages are viruses that will show up whenever you have a bacteria infection. They come with the bacteria, okay? So for instance, there is a newer way of testing to see if you have Lyme, to see if you have Lyme in you, and that is to measure, do you have a lot of Lyme phages in you? And if you have Lyme phages in you, then you probably have a Lyme. And there's an idea that if we measure those Lyme phages, the amount of phages we measure is a good way of determining, and a more direct way of determining what is your Lyme germ load, all right? Keep in mind that we have a hard time culturing Lyme, so we're not really able to figure out how much Lyme is in you, and that Lyme hides, and so it's kind of hard to do testing for it. Now, that testing, that phage testing, is being done by a lab out of Europe called Red Labs, and frankly, I just don't know if it's valid. I know what they claim to do, but I'm just not clear it's a valid way, really, that it really works correctly. Okay. Now, Jernigan in his clinic in Tennessee, claims to have a technique that he can do that he uses electronic signatures of these phages and uses I guess frequencies or some way. He turns on these phages that are in you to then start attacking your Lyme germ. All right, that's his claim. Okay, now I don't know. I mean, he's the only one that's evaluated this. He's published a case study or a series about his patients that he did this on. And it's a series involving 26 people where he shows supposedly they had good benefit. Okay. But 26 is a small number to make claims on. I just want you to know that. Okay. In addition, nobody has verified anything about this. The problem I have with this technique too is it's a quote unquote proprietary technique. This machine that he uses to turn on the phages is proprietary. So we have no way of independently going out there and seeing if anything that he claims to be doing or the benefits of his machine can be validated or not. So I don't know. Maybe it works. The one thing I have found, and I know his published studies claims that he has great benefits in those 26 people, but there's just over time in managing Lyme, I've learned something, and that is if there's a claim of something really working well, it's probably, if it seems like it's too good to be true, it's too good to be true. So we've been down this many roads before. I mean, many of you know, all of a sudden, about a few years ago, we were all trying disulfiram with everyone, and it seemed like this was going to be the miracle cure for many people. But we learned that it helps maybe 30% of people, but a lot of people have terrible side effects and have a hard time, and some even get permanent neurologic injury from it. Okay. So Jernigan's well-intended. He is adamantly opposed to antibiotics, and even although his previous practice in Kansas, he did use herbal antibiotics. It's just he's got his own way of doing things, and I can't tell whether it's valid or not. I'll just say that. So I don't know. I don't have enough data, and I'm always skeptical of people that are using proprietary techniques that we have a hard time looking in on and seeing what the heck's going on. Okay. All right. There you go. You got my 2 cents on it. Good luck to you, Linda. Hi, Dave. Let's see. Can you change the mold binders midway, or do you need to first stop the original binder, wait a week or a few days, then begin the new binder? If you start a new binder, do you start slowly and build up again as in the original binder, or go straight to 2 times daily as usual? So, there's a variety of ways you can do this. What I generally, so just one comment. Even though you may have worked up with one type of binder to 2 pills twice a day, usually when I start another binder, I usually will start low. And the reason is each binder may work a little differently. And so I've had people that have had just strong reactions to getting too aggressive with their removing mold toxins. So generally my approach is when I make a change to a new one, I start low and build up. Okay. And generally the way I will do it, I'll have a person stop one day on one and the next day begin the next one. So if I had a person, let's say they were on a mycopole by Research Nutritionals, and they were doing 2 pills twice a day, and I thought, well, this isn't working well enough. I want to change you over to citrus pectin and activated charcoal. I might start at 1 scoop 1 time a day of the citrus pectin and 1 pill a day of the activated charcoal. And after a week, if somebody's doing well, I might go up to 1 scoop twice a day of that pectin, and then 1 scoop or 1 pill twice a day of the fractionated or of the activated charcoal. Okay. Now, I don't know your situation, how reactive you are. I might go slower. I might go less aggressive. I might go more aggressive than that. But the point is, just because you've tolerated one and you've worked up high on one doesn't mean that when you add in the next one, you won't but you won't have a strong cytokine reaction. Okay. So when you start pulling toxins out, everyone, it causes a cytokine surge, which can look like a Herxheimer reaction. But technically, it's not a Herxheimer reaction. A Herxheimer reaction is also a cytokine surge. But what makes it a Herxheimer reaction is it's what occurs when we kill germs. okay? But if you get a cytokine surge from moving toxins around, that's just called a cytokine surge. It's not really called a Herxheimer reaction, technically. Okay? All right. Good luck to you, Dave. Hello, Lynn. Hi, Dr. Ross. If the real-time labs come back positive for gliotoxin, is there a test to differentiate whether that is from Aspergillus or yeast? Also, it's been suggested that I take berberine to normalize my blood sugar level, and I'm wondering if I can kill two birds with one stone by using it to kill yeast, if that's what I have. Is berberine an effective killer of yeast, effective enough that I could use it in place of the Capri Plus? And how does berberine compare to Capri Plus when it comes to disrupting the microbiome and killing probiotics? If taking berberine and Capri Plus together, how would you dose them? Okay, so number of things. So berberine, I have not found to be that effective against yeast. Okay, where I have tended to use it is in people that have growth in their intestines of unhealthy bacteria. It's one of the herbs you can use to try to eliminate unhealthy bacteria, not good bacteria, but unhealthy bacteria. But in terms of it being a useful killer of a yeast or a useful killer of mold, that is not where I would go. I usually use it more as an antibacterial, actually. Okay. And then in terms of your question about gliotoxin, so gliotoxin is a toxin that can come from Aspergillus, or it can come from Candida yeast. Okay, so the kind of yeast that's Candida albicans. Okay. I have not found a good way of differentiating from a testing standpoint what is the source of that. But if I've got somebody that has a lot of symptoms of intestinal yeast, I'm going to clear that first, okay? And so what are the symptoms of intestinal yeast? Well, sugar cravings, large amounts of sugar cravings, intestinal gasiness or bloating. Sometimes if you get too many yeast in the intestines, they will also interact, they will release toxins that interact with the skin, causing people to get a lot of pimples or acne. So if you suddenly got a big pimple acne problem you didn't have before, that can sometimes be a sign of intestinal yeast overgrowth. Also, intestinal yeast overgrowth sometimes will cause more reactivity of your histamine system, leading to worsening of your eczema type reactions as well too. If you're a woman, people with intestinal yeast overgrowth can also at the same time get a vaginal itching, vaginal discharge from yeast. And so those are things to keep in mind as well too. Okay. Can you take berberine and Capri Plus together? Yes, you absolutely can. Yeah. So anyhow, there you go. Good luck to you, Lynn. Hello, Alex. Let's see. Are Lyme patients more prone to having mold toxicity? Seems like most cases I hear about mold toxicity also in Lyme patients. Any connection? No, they're not any more susceptible. So if we look at, even though I dispute or have problems with Dr. Shoemaker's approach and how he does his diagnosis of mold toxicity and how he treats mold toxicity, I do agree with Bart. We learn a lot of good things from him. One of the things we learned by his genetic analysis is that about 25% of all people have a genetic predisposition where they might not be able to handle mold toxins. Okay. Now, that means there's 25% of people walking around out there that don't have Lyme that may have mold toxicity issues if they were to be exposed, or it would start becoming part of their problem if they have something else that adds to the problem pool. Okay. So it is possible that there are people out there walking around that have a lot of mold toxins in them, but they don't have any symptoms. Because even though the mold toxins are high, there isn't anything else assaulting the body. There isn't anything else adding to the total load of illness in the body, and they can just live with those toxins, okay? But now, if you're a person with Lyme, you've got two things that add to the load of illness in your body, and collectively they can add up to create problems. All right. So if you've got mold toxin illness and you're tolerating it, suddenly you get Lyme. It's like you put more drops in the rain barrel and the rain barrel starts overflowing. All right. So your rain barrel at one time could handle all the water contributed that gave you mold toxins, but now you put the Lyme into the mix, and suddenly you suddenly have health problems. And so then when that happens, we start looking for all the contributors to those health problems, and we find you got mold and you got Lyme. And so what we want to do is deal with both to lower the water level in your rain barrel so you don't have health problems anymore. Okay. All right, I hope you hear what my analogy is. It isn't so much that more people with Lyme have it. It's that we go looking for it in Lyme, and we recognize that it is something that can contribute to the overall load phenomenon causing health problems in a person. There probably are 25% of people out there walking around that have some mold levels in them. Many just may not have symptoms from it. Okay. All right. Good luck to you, Alex. Hello, Deborah. Let's see. Hi. Let's see. What are your thoughts on the new Novavax vaccine from Europe? I've not been vaccinated. Thanks so much for these webinars. Deborah, I know that it's just approved. I don't have enough information yet to make a comment on that. I have to do some more reading. So that's where I'll leave that. Okay. But thanks for the question. Oops. Let's see. I think TJ, I just eliminated your question. You asked about what are the symptoms of alpha-gal. And my understanding, I haven't had anyone have this before, but alpha-gal, which you can get from, I think, the Lone Star tick. It's not from all ticks, but it's transmitted, a condition that occurs from tick bites. And again, I'm not the biggest expert on this. It leads to meat allergies, actually. People start reacting to meat. And I have not had that happen to anyone in my practice yet, but so that's what I know about it. Okay. I would consider myself the best alpha-gal expert, actually. All right. Good luck to you. All right. Let's see here. Hello, Linda. Let's see. Can you please talk about we did that earlier. Hello, Kate. Let's see. I had Lyme 2 years ago and don't have symptoms anymore and haven't since 2020. Looking for possible causes. Sometimes I feel groggy on and off throughout the day, almost like the melatonin hangover feeling. I've only taken melatonin like 2 times in my whole life, and it made me feel weird, so I abstained. I've been looking into cortisol, HPA axis stuff, interestingly. Low-dose naltrexone increased my cortisol and certain sex hormones, known side effect of full-strength naltrexone. And I feel like I felt like this then, but I'm not on the LDN anymore. This has also impacted my motivation to complete tasks. I often notice at work, but when I'm home, sometimes it fades. Like to know if this is merely stress or a combo or more. I don't know. Kate, I would need to, you've given me a lot of information, so thanks for that, but I need to do more of a give and take type questioning with you to help sort this out. I can't tell from what you said here. Okay. All right. Good luck to you. Hello, Matthias. Let's see. How safe is it to kiss someone when I'm still sick? I'm worried I can transmit this awful disease to someone else. I know there is some research indicating Lyme is an STD, so condoms should be used during sex. But does this risk also apply to kissing? In my specific case, the woman I like has a very weak immune system. So, Matthias, all I can say is I have never seen any studies that say it can be transmitted through your saliva. All right. And that's generally what I advise my patients as well, too. So that's what I would share with you. Okay. All right. Good luck to you. Hello, Laura T. Hi, Dr. Ross. Can Lyme and or Bartonella alter one's genes, DNA, or the way the body handles certain medications, namely SSRIs? At one point years ago, pre-Lyme and Bart, I was able to handle Paxil, but now when attempting to take another SSRI, I ended up going through a serotonin storm. I wonder if somehow the way my body handles SSRIs is altered. Thanks for your help. So, Laura, it's an interesting question. I haven't seen that happen before. I am not aware of any research literature saying that that can happen. So I would say I'm not aware of it. Now, that's not to say Lyme didn't do something or Bartonella didn't do something that triggered it. I'm just not aware of it, okay? Nor have I heard reports of it. It's not a common thing that those of us that treat Lyme see, okay? All right. Thanks for that question, Laura. Good luck to you. Hello, Ms. E. What do you know about teeth gum issues as it relates to spirochetes in the mouth? Let's see. Mast cell activation syndrome and how that contributes to gum issues. 2 different biologic dentists revealed through mouth tests spirochetes, and based on a fractured tooth and 3 gum pockets at level 7, and 2 of those with infections in the pocket recommending extraction. We'll do ozone therapy, which is said to kill bacteria and speed up healing. Wondering if doing the extractions will disrupt the spirochetes and be activated. Hope this makes sense. Thank you so much for all you do for all of us. Blessings. Okay, so I know. So, for instance, I have gone to a biologic dentist myself too. That would do scrapings of my germs my mouth each time they were doing cleaning. And spirochetes will show up. Now, what I want to let you know is not all spirochetes are Lyme. Okay, there's a group of spirochetes that can show up and that have nothing to do with Lyme. So just be aware of that. Okay, and nor can they tell by looking into the microscope is that Lyme or not. All right, so that's one thing to keep in mind. Second thing is that one of the things that can make it difficult for people with Lyme to recover is there is a small group of people that do develop infection pockets under their teeth where Lyme can live. And so if somebody does have one of these pockets under their teeth, I usually do want them to get those treated in case there are Lyme spirochetes there that would be there, okay? And doing injectable ozone is often a way that can help with that in those pockets, okay? So those are 2 things for you to think about. Now, will doing your dental work that you've outlined here activate Lyme? I don't think so, all right? But those are my thoughts on it, okay? All right, good luck to you. Hello, Charles. Hello, Dr. Ross. Does omeprazole have any effect on candida? My provider wants me to take it for heartburn, which isn't too bad, but I don't want to mess up my candida treatment. Since it's an azole, you think it's a good choice? It's a different kind of azole. I'll come back to you here in a minute on that. I think I see what you're saying. I'll make a comment here in a minute. Let's see. Number 2, can you take Phytosand or Capri Plus at the same time as probiotics? Thanks for all your help. Okay, so omeprazole is in a class of medicines known as proton pump inhibitors. Okay, they are not antimicrobials. They work by basically blocking a mechanism in the stomach that leads to acid production. All right. Now, it is true they end in the letters azole, azole. All right. There are a group of antimicrobials called the azoles. And in that family are things like fluconazole, tinidazole. Tinidazole is actually an antibacterial. Fluconazole, itraconazole. But azoles can help fight infections, okay? Those azoles, those antimicrobial azoles. But omeprazole is just useful at lowering acid, basically, okay? I have not seen anything that says that omeprazole actually leads to candida increase, nor have I seen that in my patients that use omeprazole. I don't see that they have an increased chance of getting yeast. Okay, I know you ran into some studies, but in a practical experience in the real world, I haven't seen an issue like that. Okay, and then can you take Phytostan and Capri Plus at the same time as probiotics? Yeah, I have people do it. I don't. If anything, the antimicrobial effect of them would be antimicrobial against unhealthy bacteria in the intestines, not healthy bacteria like the bacteria in your probiotics. Okay? All right. Good luck to you, Charles. Hello, Beth. Let's see. During what phase of Lyme treatment do you introduce peptides to help with mitochondrial function and energy? Should you wait until finished with the herbal or antibiotic protocol to kill the Lyme co-infections, or start it during the middle of the treatment process? Okay. So generally, in my treatment approach, keep in mind there's a number of things that can lead to fatigue. Okay, so one of the things that can lead to fatigue is hormonal dysfunction, like low adrenals, low thyroid. Okay. A second thing that can lead to fatigue is having too many cytokines. Cytokines cause fatigue. They have a symptom of causing fatigue. Okay. And then finally, having mitochondrial dysfunction. All right. And we do not have a good test for mitochondrial dysfunction. So what my approach is to treat people for about 6 to 9 months before I start thinking of doing anything for mitochondrial support. Generally, okay, when people that I'm starting fresh on treatment. And the reason for that is over 6 to 9 months, if you've got them on herbal or prescription antibiotics to knock down their Lyme germ, over time, that should start reducing the amount of cytokines that are in there, all right? So we lower the amount of cytokines, and just doing that may be enough to get the energy better again. In addition, lowering your cytokines will help your adrenals and your thyroid to start working better, and usually we'll have done things to correct for adrenal and thyroid issues as well too. So if we've corrected those and we've lowered germ load and lowered cytokines, and somebody is still having a lot of fatigue, that's when I start thinking it's time to start focusing on mitochondria. All right. I would, however, not use peptides at that point. At that point, 6 to 9 months in, is when I would start doing more direct mitochondrial repair by trying to fix the outer membrane of the mitochondria. So what happens with mitochondria dysfunction often is that the oxidizing agents that the immune system makes to get rid of infection can sometimes lead to damage of the covering of your mitochondria. All right. So rather than trying to focus on peptide therapy to fix the mitochondria, what I like to do is do things to fix the outer membrane directly. And what is good to do that is to do phospholipid repair. And the main product I like using for that is a product called ATP 360 by Research Nutritionals. It's made up of a bunch of phospholipids and nutrients that help your mitochondria work. We've got good studies done that they conducted that show benefit of using it. And I have people do 3 pills 1 time a day to rebuild the covering. In addition, the other key component that I will do for mitochondria repair is to get people on a strong antioxidant, which is glutathione. And I'll have people take a teaspoonful of that Tri-Fortify product by Research Nutritionals 1 time a day as well, too. All right. Now, I will try that first. And I'll try that for at least a couple months. And if that works, great. If they're getting better, then I will continue it 4 more months. All right. But let's say you do the mitochondrial repair work by repairing the membrane, and you're repairing and you're doing the antioxidants, and you're 2 months into that and your energy still isn't improving, then is what I would think about doing peptide therapy for that. And that would be the BPC 157. And I would start it at 1 pill twice a day. Okay. So I kind of stage my approach because not everyone with fatigue has mitochondrial dysfunction. all right? And sometimes just getting your germ load down, which helps lower cytokines, and get your adrenal and thyroid corrected, it's going to get you back on your way, and the fatigue is going to lift all on its own, and you never have to do anything to fix the mitochondria, okay? All right. Good luck to you, Beth. I'll do a quick screen share here. All right, so, oops. So this is my supplement store, everyone. If you're looking where to find products I've talked about tonight, anyone can order from here. Or you're wondering what products that have curcumin in it that I recommend, just type curcumin here and you'd see which products I use in my practice that I find helpful, okay? All right, over here at my Lyme disease information site, Treat Lyme by Marty Ross MD, if you're looking for more information about two things, number one, about mitochondrial repair, take a look at my section called Energy and Fatigue and look at this chapter called How to Fix Mitochondria and Get Energy in Lyme Disease. At this point, I don't even mention anything in here about peptides. I probably need to do an update. But again, I would not add, I would do the approach I mentioned here first for at least 2 months before even considering adding peptide therapy in, all right? And for those of you that are new to the idea of peptides, in terms of taking a look at that, let's go over here to so this is if you saw what I just did here, I just clicked on this latest button. If you're ever wondering what's the latest thing I wrote, this is where you'll find them, okay? So for instance, yesterday I posted an article about theories about why people can't recover from Lyme even if they've done years of antibiotics. And those theories give us some ideas of things you can try that might be helpful. So that's that article right there, all right? But there is an article I wrote here about peptides, I think maybe a couple months ago, and it's called Repair and Restore with Peptides in Lyme Disease and Mold Toxins. And I outlined a number of peptides that are oral peptides you can use and how they might be beneficial, okay? So you can take a look at that article as well, too. All right. Hello, T. Let's see here. Since becoming ill, I'm highly sensitive to many foods, especially derivatives of corn or sulfur. How would you prioritize treatment for Lyme, BART, Babesia, H. pylori, C. diff without triggering allergies? Thank you so much for all you do. So when people have become very sensitive to various items in their food, I start thinking about leaky gut. And one of the and what leaky gut means, let me explain, you may know, but so basically, in terms of intestinal architecture, you've got the inside of the intestines where all your poop is, okay? Then you have a layer of cells, so you got inside of the intestines, layer of cells, and then under this layer of cells, you've got 70% of the body's immune cells, and you got a bunch of blood vessels, all right? The way that things are supposed to get from here into the bloodstream is that these cells have very tight junctions. There's no gaps, okay, in healthy functioning intestines. And basically bacteria up here do microdigestion of your food components, breaking them into small particles of fats, small particles of proteins, small particles of sugar that are no longer recognizable as coming from corn or coming from whatever, okay? And they get absorbed into these cells and they pass through all these immune cells and into your bloodstream. That's in a healthy functioning intestine, all right? Now, in leaky gut, what happens is these cells plump up and pull apart and they get gaps. And now you've got partially digested sugars and protein that look like corn and look like wheat and look like whatever you're reacting to. And they hit all these immune cells down here and they react. These immune cells react, okay? All right, so that's leaky gut. Okay, now what leads to leaky gut? The number one reason of leaky gut is too many yeast in your intestines, okay? So if I've got somebody that's got a lot of food sensitivities and allergies, the first thing I'm going to do is to try to figure out, do they have too many yeast going on? And if they do, I'm going to want to take care of that problem. All right. So you need to look and see, do you have too many yeast? That's where I would start with you, actually. Because often if you can clear the yeast, then your leaky gut will resolve. All right. And that's where I would go first. I would see if that's what you got. So let me show you how to do that. All right, so take a look in my stomach and intestines chapter, first of all. And somewhere in here, I got an explanation of leaky gut. Yeah. So here's my leaky gut article where I talk about getting the infections out and then things you can do to start repairing the cells that line the intestines too. Okay. And then in terms of figuring out, do you have yeast? Take a look at this article, A Silent Problem. Is it yeast? There's a questionnaire in here you can fill out that will help you figure out from a score standpoint and a risk factor standpoint, do you have enough stuff going on to call it yeast? Okay. And then if you do, here's my article called Kills Yeast, a Brief Guide that gives you ideas on what to do to get rid of that yeast. Okay. All right. All right. Good luck to you, T. Looks like, Kate, it looks like you posted your question 2 places. Let me get rid of the second one here. Hello, Thomas. Let's see. I have a lot of burning skin around my chin, jaw. Is that a symptom you've seen before? So, as I mentioned earlier tonight, burning, that sensation of burning on the skin often means neuropathy, okay? However, if you have actually burned your skin, it can burn, all right? And also if you have rashes there, that would give you burning. But if you look at your skin and it's normal looking, then burning usually means a sign of neuropathy, okay? All right. Hello, Astrid. Let's see. Hi, Dr. Ross. Thank you for these informative webinars. You're welcome. I learn so much every week. Once I am well from Lyme, how do I keep myself in remission? Good question. So one of the things, so there's a few points I want to make. Number one, that when we get people well from Lyme, in some people, we actually may eradicate the germ, all right? We have no way of knowing, though. So so it is possible we get rid of the germ. I mean, although it can be difficult, we know Lyme hides in a lot of places in the body, and we've got the issues of persisters, all these things that would make it hard to get rid of it. It is possible, even if you've had Lyme in you for 20 years when you get treated, that we might eradicate Lyme. Now, we have no testing that proves that we eradicate Lyme, all right? We just don't have valid testing to do that. There is a general opinion among most of us that treat Lyme that have done this for decades now, that if we get somebody well and they stay well for 2 years, there is a high probability we have cured them, that they're not going to relapse. Okay? Now, the idea of relapse means that there's probably still some germ in you, or the idea of staying in remission, what that means is, what do you do to keep the germ from coming back, which presumes we haven't gotten rid of it, okay? All right. So I just want to make a distinction there that I think that it is possible to get rid of the germ in people that have chronic Lyme, all right? So what my general approach is at the end of treatment, I'll have a discussion with my patients and try to get some ideas on what they might want to do, all right? So number one, and I've got an article about this too, I'll show you here in a minute. At a minimum, you want to do things to maintain a healthy functioning immune system, okay? So number one, you want to make sure you're getting adequate sleep. Get your 7 to 9 hours of sleep at night. That's one of the things that's best for the immune system, so the immune system can keep things under control if you still have germs in you, okay? Number two, I like to suggest people to do regular exercise that you can tolerate. Okay, now, I understand, and I know that Lyme makes it sometimes so that even after you get over Lyme, you may not have the exercise tolerance you did before, but find a level you can tolerate that doesn't knock you down the next day, basically, and try to do that fairly regularly, okay? Because exercise also supports a healthy functioning immune system, okay? Number 3, eat healthy. Do not do the standard American diet. We call that the SAD diet. Okay, that's the McDonald's and the pizza every night. Those kind of diets that are not heavily plant-based and not using healthy fat sources actually will make your immune system do terrible. All right. So what is a healthy diet? Well, it tends to be a diet that emphasizes a lot of plants and fruits and vegetables. Okay. You can do things like animal protein, but you want to try to balance non-inflammatory animal protein in there. And that can be things like fish, especially cold water fish like salmon, okay? Or if you're going to do beef or buffalo, you want to do grass-fed as much as you can because there's healthy fats that come out of there, okay? So what is a good diet to consider? Well, Mediterranean style diet can be good. It's heavily plant-based, tends to have a lot of healthy fats in it that are anti-inflammatory. The other thing you can do is a paleo type diet that emphasizes healthy proteins, meaning with healthy anti-inflammatory fats, and is heavily plant-based. And I'll show you one you can look at here in a minute on that. Okay. So number 1, sleep. Number 2, exercise. Number 3, healthy diet. Number 4, try to keep toxins out of your environment. And by that, I mean toxins in your home environment, like cleaners and things like that. Make sure you don't suddenly move into a home of mold toxins, all right? But also do what you need to do to deal with all your toxic life situations, like your partner who drives you nuts that you haven't dealt with by talking with them and trying to get them working something out with them, okay? Or that job that you find toxic. I mean, you got to get the toxins out of your life because those toxins will suppress your immune system. Or if you can't get them out of your life, I'm not advocating divorce, but you got to, or split from your job, but find a way to deal with those toxins, whether it's counseling, creating changes that make those situations better for you, whatever it is you need to do, or ultimately remove yourself from those situations if you need to, but get the toxins taken care of in your life, all right? So those are a minimum what I would do, all right? The other thing I will discuss with my patients at the end is, do they want to be on something to do germ control, to police the environment, if you will, okay? And so one of those could be being on half a dose of an Otoba bark and a cat's claw, for instance. So instead of doing 30 drops twice a day, you might just do 30 drops once a day. Okay. Or the other option, be on a clarithromycin, 500 milligrams one time a day instead of being on it twice a day. All right. Now, I tend to reserve using ongoing antimicrobials for people that have actually relapsed. So they've done well for a while, they come back in and they've relapsed. Often, if that's the situation, those are the people I'm going to talk about being on something that is going to actually police the environment, if you will. All right. And then finally, the other thing I would do is to try to be on immune supportive herbs that help turn your immune system on to target Lyme. So one of those could be to do something called transfer factor L+. Transfer factors are proteins that are made by some parts of the immune system that help the immune system target certain infections. So for any kind of germ we ever have in us, we make specific transfer factors for that germ. So if you've ever had mycoplasma in you, you have made mycoplasma transfer factors. If you've ever had a cold virus in you, you make transfer factors against the cold, all right? And then what is in transfer factor L+, which is a product by Research Nutritionals, is it has transfer factors in it against Lyme, which is Borrelia, Bartonella, Babesia, Ehrlichia, Anaplasma, Chlamydia pneumoniae, HHV6, and which is a virus, and Epstein-Barr virus, and I believe cytomegalovirus is in there too. It's the most targeted transfer factor we can use, and that would be 1 pill twice a day. Another thing you can do is just generally rev up the cells that fight infection in your body and that would be to use reishi mushrooms, which is a mushroom mix that has reishi in it, some maitake, some shiitake, some cordyceps, a mushroom mix, and you would do one pill 2 or 3 times a day of that. Okay, so I've written this all down. Let me show you an article you can take a look at. All right, so take a look. There's a section here I call end of treatment. Somewhere here it is. Here it is. End of treatment. All right, and then there's this article called Finished and How to Prevent Relapse. And one of the first articles I ever wrote, but it still stands, and it's built around a person that was stopping treatment in my practice. All right. So anyhow, I talk about the mushroom formula down here. I talk about the transfer factor L plus, for instance. I talk about exercise, et cetera, et cetera. It's all in here. Okay. All right.
Those of us that have treated chronic Lyme, most of us agree that we probably never get rid of every germ. That the best that we're doing is knocking the germ so it's under control. Your immune system is keeping it.
What have I done here? Hold on here a minute.
So there is a risk that at some point,
I believe I've turned the video on. Oh, I see what I did. Here.
Right. Now,
there we go. I was in that article. That article I was just showing you actually has a video in it, and it started playing. I was trying to figure out where's my voice coming from. So it was on the computer. Anyway, I just turned that off. So that's why you were hearing me twice. Anyhow, there you go, Astrid. Good luck to you. Hold on here a minute, everyone. Hello, Albert. Let's see. Hi, Dr. Ross. I haven't had any obvious symptoms of Lyme for over a year, but when health issues pop up, I wonder if they could be Lyme related. Recently, my cholesterol test showed my LDL was elevated. Are you aware of any connection between Lyme and increased cholesterol? Can you recommend any supplements to help lower it? It's interesting. I was at a conference maybe a month ago down in San Diego. Is a hormonal therapy conference. And one of the discussions was talking about LDL, which was part of a discussion. Clearly that's not a hormone, but there was a discussion about LDL. And there was some labs showing, or there was some evidence showing that LDL can go up with acute inflammation. So, and that would be cytokine inflammation. So is it possible Lyme could cause elevated LDL and it would be, increased cytokines cause it to go up. So it's possible when you start killing germs, for instance, that those increased cytokines might trigger the LDL to go up. I know I've had a number of my patients in my practice that they did start developing elevated cholesterol levels that they never had before we started treating. And I now wonder, in retrospect, based upon what I saw this about a month ago, if that might have been just increased cytokines from killing germs triggered their LDL elevation. All right. But you're in a different situation. You said you haven't had any obvious symptoms for over a year. In that case, I don't think it would be Lyme or treating Lyme that would be causing it. People do, keep in mind, people with Lyme do get regular health problems. All right. So we can't always look at everything as being caused by Lyme. I would suggest probably that this is a non-Lyme related problem. All right. In terms of what my approach that I like to do, so the prescription doctors, they're gonna put you on one of the statins. That's what they like to do. There's other ways to lower cholesterol, though. One way is to do fish oil. Up to about 3,000 milligrams a day, and often can be helpful. There is an herb called red yeast rice extract that actually has a mechanism of how it works similar to the statins, but seems to be better tolerated and not have all the harmful effects that statins do. That's another thing to consider. But you might want to talk to a functional medicine doctor who can help you look at some of those alternatives. Okay? All right. Good luck to you, Albert. Hello, Mosby. Let's see. My legs feel very heavy and weak and burned. Do you know what causes this? Burning, again, could be neurologic. And sometimes if you have neurologic injury, that will make it so that your legs are heavy and weak. So one thing is possible neuropathy. It is also possible that as part of this, you could have mitochondria dysfunction, which would give you weakness and heaviness and even lead to dysfunction of your nerves as well, too. And I talked earlier tonight about mitochondria dysfunction as well, too. Okay. Those would be just some thoughts I have. That's something you probably should talk to your doctor. They need to examine you and figure out if there's something else going on, like pinching of the nerves in the back, for instance, giving a sensation like that as well, too. Okay. All right. Good luck to you, Mosby. Hello, Flickerine. Let's see. My son has been treating yeast with fluconazole and nystatin and starting to have pretty bad stomach aches that don't seem necessarily like gas. He says it's more like his muscles are aching. Would probiotics help with this? Maybe. He is taking curcumin and quercetin as well. Could it be the quercetin? And if so, is there anything we can do about it? Thank you for sharing your information with us. Okay, so a couple things to think about. In some people, nystatin can be very irritating to the stomach. So it's possible that nystatin is acting as an irritant. To find out if that is the problem, stop the nystatin and see if that achiness goes away over a few days. If it does, it's the nystatin. Okay. The other thing to consider, though, is that fluconazole, which is an azole, can sometimes lead to liver inflammation, which would give achiness like you're describing as well, too. What I would do with a situation like this is try to stop the nystatin first. If within a few days that doesn't seem to help, then I would go ahead and get a blood test to see how the liver function is doing, okay? That's how I would proceed at this point, all right? All right. Good luck to your son, Flickering. All right, bye-bye. Hello, Joyce. Let's see. Hi, Dr. Ross. Hope all is well with you. I have had Lyme as well as Babesia and Bartonella for about 20 years, but not officially diagnosed until 2016, at which time I started a short stint with pharmaceuticals and then herbs ever since. Babesia seems under control, but when I try to back off the herbs you suggest for Burling and Bart, symptoms return about 3 months later. What do you suggest for long-term use? Do I try something else or take a lower dose daily or alternate days, etc.? I appreciate all you've done to get me this far. Wish I could find a knowledgeable Lyme doctor here in Arizona. All right. So Joyce, one thing I would make sure of, and one of the things that we see that can, in theory, can lead to relapse easily is if we didn't deal with what are known as the persisters. So, and you may be doing this, but I just want to be thorough. So Lyme has growing forms and Lyme has hibernating persister forms. The cat's claw and Otoba that I recommend, only the cat's claw has got some evidence that it might deal with persisters. So therefore, when I have somebody I'm treating for Lyme for persisters, I want to have them on something else that targets persisters. And usually I'm going to do a liposomal cinnamon clove oregano, 1 pill twice a day. I might do a cryptolapis, 5 milliliters 3 times a day. Those are some things you can do to target the persisters, okay? Same with the Bartonella. Bartonella has growing and persister forms. The Hutaniacida acuta that I usually recommend for Bartonella, I've never seen any science that they've done to look at whether it treats persisters. They might, we just don't know. So on my Bartonella treatments, I'm also going to have people take something to prevent or to treat the persisters, and that would be the liposomal cinnamon clove oregano capsules, 1 pill twice a day, or cryptolepis. The evidence out of Johns Hopkins from last year says cryptolepis also will help growing and persister Bartonella, and that's 5 milliliters 3 times a day. Okay. But let's say you're already doing it. Let's say you've been doing the herbs I just mentioned, and you've been doing something for persisters, and you keep relapsing. Then the next thing I would probably do in my practice, if you're in my practice, is I would change up your treatment herbally to something you haven't been doing. I would give a try at trying to put together a mix of things that kill living and persister Lyme and or Bartonella that haven't been part of your treatment, and see maybe they'll work better at getting things taken care of here for you. Okay. So the standard herbs I recommend for treating Lyme would be a cat's claw atoba, and I would couple it with a liposomal cinnamon clove oregano. Okay. But if somebody keeps failing on that, the next thing I might try would be to do a teasel root and work up to 30 drops twice a day. And I might combine that with a Japanese knotweed at 30 drop, or at probably work up to a half teaspoon 3 times a day. Start at a quarter teaspoon 3 times a day, and then work up to a half teaspoon 3 times a day. The knotweed presumably can help with persisters, but I would still want to do something else. So either a cryptolepis or liposomal cinnamon clove oregano with that. Okay. And then in terms of the Bartonella, cryptolepis treats growing and persister Bartonella, and Japanese knotweed can treat growing and persister Bartonella. Those two might be your new Bartonella treatment. But I would try those. I would try to change up what you've been doing in case your germs learned some resistance to what you've been doing. Okay? All right. Good luck to you, Joyce. Hello, Lucas. Let's see. Hello, I have a question about diagnosis. My 2-year-old seemed to have developed a bullseye rash during the morning. We didn't witness a tick, but there is a bit or a bite. All right. So let's see here if there's another part to your question here, Lucas. All right. So the one thing I want to let you know is not everything that looks like a bullseye is caused by Lyme. All right, so this gets to be a little bit tricky. So there's things to consider here, Lucas, and ultimately, and I think I know which Lucas you are, ultimately, you need to weigh out risk and benefit. So first of all, you need to realize that, so for instance, if you had seen a tick attached, and there was a bullseye rash, I would say, yes, you definitely should do something for your 2-year-old to prevent Lyme, especially if you are the Lucas I know that is up in the Canmore area of British Columbia. I'm sorry, of Alberta, okay, where I know there's a lot of Lyme, okay? So the things I consider are, the greatest risk of getting Lyme is if there's a known tick attached and you are in an area where there happens to be a lot of Lyme. Okay, but if where this occurred is not in an area where there's known to be a lot of Lyme and you did not see a tick, then what you're left with is a bullseye rash, and you have to weigh out that it might not be from Lyme, and so you have to consider: do you want to put somebody on antibiotics for something that you're not sure would be Lyme or not? And that becomes a discussion of risk and benefits, and that is something I would want to do in person, actually. Now, be aware that if you are the Lucas I'm thinking of, I am not available to have a visit with you until next week, but that's fine. with an acute case of Lyme, or if there is an acute case of Lyme, you don't need to start the antibiotics the day one. It can, as long as you're within the first week to 2 weeks, you're fine. Okay. So this is something that you and I could discuss with a half-hour conversation, but I would set something up for next week if you are that Lucas. All right. All right. Good luck to you. All right. Let's see here. Yeah, it's about that time. So it's about 5:30 here, my time. And I think I'm going to end the webinar for tonight. So great being here with you tonight, everyone. It was fun to share information with you, and I hope you got some useful information to help your treatments as well, too. Tomorrow morning, somewhere between 9:30 in the morning, you'll get an email from me, usually between 9 and 9:30, sometimes earlier, sometimes a little later. You get an email from me that will summarize the topics we discussed about in the webinar tonight, and it will also include a link to watch that webinar too. Okay. Now, keep in mind, as I said earlier, that the webinar next week is going to be Wednesday at 4 p.m. Seattle time. Okay. So same time, different day. Okay. And so you'll have a link to sign up for that as well in the email that comes out tomorrow morning. Okay. All right. So good night, everyone. And I wish you all well. Take care.